My name is Arslan Ahmed. I am a general cardiologist at Genesis Heart Vascular Group. I did most of my medical training in Omaha, Nebraska. I graduated from med school in Lahore, Pakistan, and then I went on to do my residency training in internal medicine at Creighton University in Omaha. I stayed there for 1 year as chief resident, and then I also did my cardiology fellowship at Creighton University. So I was drawn to the field of cardiology from very early days in my medical school. I was always fascinated by the heart, and I tell my patients, a lot of times that if you want to take a look at a medical, just take a look at your heart. So naturally, when I came into clinical medicine, I decided to go into cardiology. And another big reason for me is that, we come into this field to make a difference in people's lives. And cardiovascular conditions are one of the leading causes of morbidity and mortality around the world. And a lot of treatment options and a lot of interventions that we can offer these days, they're much more advanced from what, maybe they used to be like 30, 40 years ago. And we continue to progress in this field. And so that's why I chose to go into cardiology. So as a general cardiologist, we deal with a broad spectrum of cardiovascular conditions, starting from preventative interventions like controlling your blood pressure, cholesterol, to treating a broad array of cardiac conditions like heart failure, coronary diseases, valvular conditions, rhythm issues. So when a patient comes to me in clinic, I like to treat them as I would like my family to be treated. My parents or my siblings. It's always good to put yourself in their shoes and think, what would you want for your parents or your siblings or for yourself? But at the same time, you also have to be cognizant of what your patients want, because people are different and they react differently to their conditions. So I try to come up with the best possible options for them, at the same time keeping in view what their priorities are for their treatment. So when I visited Zanesville, I was very impressed by the facilities here at Genesis Hospital. I think we're providing a very comprehensive cardiac care in a community hospital setting. We have all the major, heart and vascular service lines, from EP to structural and interventional cardiology and CT surgery. And the other thing that really impressed me about this place is that Genesis as an organization is always looking to grow and improve. They're always asking us what new maybe diagnostic modalities or treatment interventions we can bring in. And that is, very good, not only for the patient population that we serve, but also, as a professional for you to grow. So that's why I chose Genesis. So when I'm not in the hospital, I enjoy spending time with my family. I have 2 girls. I enjoy spending time with them. And then I love watching movies. I enjoy playing soccer. Those are some of the things that I do in my spare time. I'm very excited to be here, and I look forward to serving the community.